We are about to commence our white coat ceremony this morning, so I'll ask if everyone can kind of grab their seats and either silence or turn off your phone.
Hello everyone, esteemed faculty, family, and friends. My name is Japdeep Shokar and I am the class president. I would like to welcome Program Director and the Chair of the Physician Assistant Program, Professor Andrea Tremingham, to the podium for the welcome address. Thank you.
Good morning, everyone. Good morning. This is always a great time for the program. Good morning, students. Well, colleagues soon. Good morning, family, friends, esteemed colleagues, the dean. I'd like to welcome you guys to this event that we have today, our white coat ceremony. And this white coat ceremony symbolizes for this class passage from student to professional. Right? And it's really important, and we are so happy to be here with you celebrating this time. First, I'd like to acknowledge our faculty and staff of the PA program, our academic coordinator, Dr. Jennifer Otey. Yes. Can you stand, please? We'll wait till she comes to the front. Senior clinical coordinator, Candida St. Hilaire. We are matching today, not intentional. We have our remediation chair, Professor Norman McCullough. Our admissions coordinator, Edward Perchick. Our co-admissions coordinator, Dr. Jonathan Silver. Esteemed faculty, Dr. Abdullah Saudi. Esteemed faculty, Professor Edison Ruiz. And what will we do without our staff? I'd like to have our program administrators come to the front to be acknowledged, please. We have our program administrator, Ms. Natasha Roberts. And our program administrator in charge of the senior students, Ms. Alfred Saunders. As the students know as well as we do, we can't really get along without them. So good morning, students, faculty, staff, friends, and family. Welcome to the 16th Annual Physician Assistant White Coat Ceremony. I want to congratulate each of you on arriving at this milestone in your career. Please give yourselves a round of applause. You have no doubt worked hard to achieve the goal of entering into PA school, and now you see your dreams turn to reality as you embark on your professional career paths. I want to spend the next few minutes reflecting with you on the nature of the journey ahead, especially as it relates to the next step, entry into professional practice. Your white coats were filled with spiral bound reference books, reference cards, index cards with patient information, folded journal articles. As physician assistant students, your white coat served as a time capsule for each rotation. The reference books in your pockets have changed throughout the course of your clerkships. Your white coats have also carried medical equipment such as stethoscopes and pen lights and tuning forks and reflex hammers even. As a result, your white coats were extremely heavy. As one's training rank increases, the number of papers, pens, reference books, and instruments decrease. With this decline in bulk comes the expansion in your clinical acumen, gestalt, professional integrity, and that sixth sense that almost all practitioners have, the undeniable, though unsubstantiated gut feeling that propels you to order that test or to examine that organ system. As each of you walks across the stage today to receive your white coat, your professional journey in medicine will begin. In the words of Sir William Osler, the practice of medicine is an art, not a trade, a calling, not a business, and you have answered that call. The white coat ceremony is a rite of passage, welcoming you as PA students into the medical profession. This ceremony will join the symbol of the white coat with virtues of altruism, responsibility, duty, honor, respect, and compassion. You are here because you are exceptional. You are here because you are worthy. But before you is a life-defining choice as to what you will do with these gifts. If you want to make a real difference in the world, whether it's in the lab, the classroom, a small rural practice, or the future chairperson of a PA program, there is simply no shortcut. To rise to the best that is in you, you have to embrace, or at least commit to embracing, all the demands, all the doubts, all the discouragements of this passage. But I promise you, it will be well worth it. Congratulations, class of 2024.
Hello, everyone. My name is Anissa Mahubi. I am the class vice president. Thank you all for being with us today. And now I would like to welcome the dean and professor of the School of Health Professions, Dr. Alan Lewis, to the podium for greetings.
Good morning. Good to see so many people here. Have lots of acknowledgments and thanks to give first and foremost. It's been a long journey, I know, and you would not be here were it not for your perseverance, students, obviously, and the dedication and commitment and support and the know-how of your faculty and staff. Professor Trimmingham just introduced each one of them. We all know they're the best, and they have gotten you to where you need to be. But we have to also do a special acknowledgement to your support systems. That would be your families and friends, without whom most of you would not be here. So if you're, let's give them a round of applause. Can't do this alone. You got to have that support, we all know. We also want to give acknowledgments to New Media Services, who have done all the setups and doing all the production stuff today, technology for us. You know, white coat ceremonies have not been around that long, for about 31 years or so, and they started right across town at Columbia. And it is, as Professor Trimmingham said, a rite of passage, and we have several other programs in this school that use the white coat ceremony as a transition between didactic training, classroom-based stuff, and when you go out into clinicals. And that used to be the case for the physician assistant program. You know, the white coat symbolizes purity, a new beginning, you know, leadership, all those great values. And now, class of 2024, you are done. I remember each of you walking across the stage back in May at commencement, And so you had to finish your clerkships. You've done that. Now you only have one more thing between you and independent practice, which is that small quiz you got to take, known as the PA National Exam on the pants. Just minimize. It's not that much. You're ready for it. You're definitely ready for it. Study a little bit, but you're ready. So you're ready to go. I mean, so as you go out with this, you're donning those white coats. You're going to start your clinical practice very soon after the quiz, and you'll be going in many directions in medicine. As we all know, medicine is a great field, and you students are very worthy. You have weathered this storm. The PA education program is not easy. And I always worry about offending physicians, but the deal is PA school is half the time of medical school, or medical training, we should say, and you learn 75% of what physicians know in half that time. So what does that mean? You're probably smarter than the average physician because you had to learn a lot of content in a very compressed period of time. And you've done that because you're here. So as you go out after today, pass the little quiz you got to take and then begin your clinical practice, remember a couple things. You're well-trained. You've gotten the best content expertise from your faculty. You don't know everything because nobody does, but you know a lot. And as you go out, remember your values. They are the principles around how you provide service. Remember that culture matters. We all have various cultural orientations, and even if the person is from the same culture as you, they're very different from you because they've had a very different life pathway. So you have to understand how that impacts service delivery. And most importantly, remember that medicine, as is a lot of things in healthcare and other fields, it's a practice. There's a reason we don't call it the perfection of medicine, because you're learning as you go. But don't be afraid of that. You still know a lot, but it's a lifelong learning endeavor. So as you go, realize there'll be times when you'll be put back to zero. Put back to zero means you see a case where all your experience and training and knowledge up to that point doesn't immediately give you the answers. So at that point, you kind of put back to zero. All the stuff you've had doesn't really help you that much. It still helps, but not that much. So what do? Consult a colleague. Call a faculty from downstate. Do some learning on the fly. We have this computer, this internet that gives you a lot of information. It's not all good information. That's why you have to be a discerning learner. But as you go forward, just realize it's the practice, so you'll take some risk, minimize them as much as you can, but you're going to do well. And we're very proud of you and proud of your families for having supported you. So have fun, enjoy the practice, you'll have a great life, you'll be saving some lives, improving health status, making some good money, and be held in high regard by society. How can you beat that? Just can't do it. Congratulations, class of 2024. You are ready. Thank you.
Now, will the class of 2024 please rise? So we're going to start donning the white coat on our recent graduates, and we ask that you make your way up the aisle. All right. It's always an honor every year to do this. I remember, I'm an alumni of this program, so I remember my white coat ceremony, so this is always kind of nostalgic. We have a new white coat ceremony recipient. Chapdeep Shokar. Anissa Mohubi. Henry Gerada. Saida Manaz. Tasfia Tabassum. David Koinov. Lin Feng. Jadia Adamis. Elif Ameti. Salma Ali. Aisha Amjad. Megan Edwards. Natasha Frazier. Natalie Jara. Ruwaida Khan. Albina Kukai. Oh. Sheila Lati. Annette Lema. Monica Long. Nathaniel Malahev. Roland Munasar. Nima Patel. Daphne Paul. Parvina Rakhimova. Valerie Semenova. Laura Silva. Michelle Satt. Ramandeep Singh. Mira Sklobo. Penina Zada. Thank you. So I'd like to ask the class of 2024 to turn around and face your family, friends, loved one support system. And let's give them a warm round of applause to our honorees. Thank you so much. I think they feel the love. So now we're going to have Henry and Saida approach the stage.
Good morning. My name is Lin Fen. I'm the class representative for New York State Society of PAs and Student Academy of the AAPAs.
Good morning, everyone. I'm Saida Manaz, the class secretary. I would like to welcome and introduce PA Henry Landais, the clinical coordinator of the physician assistant program, to offer the class of 2024 their send-off note.
Good morning, everyone. Good morning. Such a great time and such an honor and a privilege. My name is Henry Landis. I'm one of the graduates from the PA program. So it's such an honor and a privilege to have a few opportunities here to talk to you guys about my experience and congratulate you guys going forward. Even though I graduated over 10 years ago, it still feels very familiar to me, and just being here, being with former colleagues and teachers, it feels very familiar, even though it's been for some time. So as I was brainstorming, what can I add to this program and what I can leave you with, I try to put myself in your shoes when I was a student and did the white coat ceremony, and I try to think about what I was thinking about during that time. And even though it was an exciting time and you made it, you got through it, you got through your clinical year, your didactic year, and your family and friends are rooting for you, there were still, at least for me, some uncertainties, in terms of what the next step, should be for me. Should I do emergency medicine? Should I do internal medicine? What specialty? And the licensing exam and interviews. So there was still a lot of uncertainties in terms of what my next step is going forward. So I thought about that as I was thinking about what to say to you guys. But today I'm going to talk about what are some certainties that come with a downstate education. And this is just for being out in the field, 10 plus years, working pretty much every day, interacting with downstate alumni, PAs, nurses, doctors, experience over 10 plus years, and I'm just going to share that in a few words. The first one that I could say is that the downstate education is very well respected in the field, 100%. The downstate education is very well respected. Now I'll give you an example. You may be going into a situation where it is tense. Maybe there's a difficult laceration waiting for you. Maybe someone's having a heart attack and the room is filled and family members are looking toward you for medical advice and guidance. And sometimes I'll just ask you, sometimes just to talk, who are you and what school did you go to? And I would say downstate. And automatically you can see the tension just kind of come down a little bit because they know that they're getting a quality professional. And sometimes they'll even talk it up for you. They'll say, hey, Henry went to downstate. Didn't your dad get treated there? And they'll like, yes, downstate. They know that they're getting someone that's going to be in your capable hands and everything's going to be okay. Also, too, when you go out on your interviews, I would go out and they'll say, hey, talk about your education. I went to downstate. And you can automatically see the employer just kind of lean back in their chair and say, downstate? Check. They're getting someone that is capable. They're getting someone that can handle the job. And also, too, when you go out in the field, prospective students are going to say, hey, what school you went to, downstate? Can I follow you? How can I get in? People, they want to get in here. They want to get in here. Can we have lunch together? They're going to follow you. They're going to really want to see, how can I emulate? How can I ask questions? You know, this is certain. When you go out in the field, they're going to say downstate, for sure. That's a check. Also, too, everyone's doing well. That's a certainty. You graduate from here, everyone's doing well. You know, my peers are all leaders, head PAs, senior PAs. Some are even business owners, integrating medicine and business together. Everyone's doing well, you know, and just from, you know, politicking on Facebook or Instagram, you can see everyone's doing well. Everyone's doing well. This education opens so many doors for people, and it's a great thing to see, you know. So definitely everyone's doing well, and not just like in working in medicine. All the dreams that you had, all the things you put off because you dedicated this 2 years to focus on your studies. You know, travel is going to be there for you. Opportunities to help your family, you know, work-life balance. All this is going to be there for you guys. All this there is waiting for you. That's a certainty for sure. And lastly, one thing I want to say too, even though there's a bunch of certainties that are going to be there with this downstate education, you know, medicine is uncertain. You know, there are going to be times where you're going to be in a situation where you may not know. And I was in those situations. You know, Zika, Ebola, COVID, you know, who knows what's next? Who knows? But just know that just the foundations that you got here at Downstate, they're still very relevant out there. Your physical exam, learnings, your medical books, things that you learn in the wards, things that you learned in your books, they're still very relevant, even like 10, 15 years down the road. So you can know that you can depend on your learnings that you had here today, even going forward. So that's a certainty. So whatever, you know, medical thing we're going to face, you know, in the next few years, just know that Downstate prepared you for that, and you're going to walk in there confident. And if you don't know, you're going to rely on your foundation, you're going to rely on your knowledge, and you're going to rely on just knowing that you can do it. That confidence comes with a downstate education. So. But, you know, the job's not done. You know, you guys still have to do the rotation, the exams, the licensing exams, whatever remaining coursework. So I wish you guys the best of that. And, you know, don't sleep on your morals. But just know that once you walk out that door, all these certainties are waiting for you guys, you know, and everything you dreamed. And I don't know about you guys, but when I was a student, me and my students, you know, colleagues, we will all dream like, we're going to do this, we're going to do that. It all happened. It all happened. But just know that all you got to have to do is just do what you guys are doing already. You know, just be kind, study hard, be professional, be the best person, not just medicine, be the best person you can be. Now, all this is going to be there for you guys, just outside that door. So good luck to you guys. I'm rooting for you guys and looking forward to seeing you guys in the field very soon.
I'd like to invite PA Landis back to the stage.
Oh, you guys didn't tell me about this.
Of course not. Why would we? And I'll tell you a little anecdote. Henry, I believe your class of 2008 or 9?
8, I think. Yeah.
2008.
When we first started.
So I'm class of 2007. Wow. So a long time, right? And I remember when I graduated, I knew I wanted to do something in education. So I came back and I was a TA in physical diagnosis lab. And Henry was my group.
Yeah, I remember
that. He gave me a time. And I was a new grad. And I was like,
yeah, I remember that.
Okay, let's find out. So Henry was always someone who asked probing questions. You could tell he was a brilliant guy. Even though he gave me the business, it propelled me to learn. So that was my first memory of Henry, and I thank you for that. Because you've made me be the professional I am. Always wanting to know, always probing, always trying to find out the why of everything, because Henry made me find out. the why of everything. So I'd like to present this to you.
Oh, wow.
And it says, with our sincerest appreciation, presented to Henry Landis, SUNY Downstate Physician Assistant Program, August 21st, 2024. Thank you so much.
Thank you. Thank you. Yeah, I mean, they didn't tell me about this, but such a great honor. This is going right on the mantle for sure, and yeah, such a great thing, and yeah, I'm rooting for you guys. I've had the privilege to kind of mentor some of you guys as well too. Everything you guys dream, you guys are going to accomplish. That's for sure. And I want you to go work hard. And then if you ever need anything, we're always here for you as well, okay?
Hello, my name is Henry Gerada. I'm the class treasurer of the PA class 2024. I would just like to introduce and welcome Ms. Frances Poe to the podium for a special presentation.
So it goes without saying, anyone who knows Frances Poe knows that, first and foremost, she's a force to be reckoned with, right? She's extremely knowledgeable. She's extremely helpful. So when I was faculty, one of the courses that I was course director for was pediatrics. And Frances Poe is the administrator for the Department of Pediatrics. And when I tell you I had some hazing, my life has just been a bunch of hazing, which makes me the person that I am right now. Frances, not only does she tell you what needs to be done, which I fully respect, she guides you in that. So it's a little bit of tough love, which I come to love and respect and honor. And so she's been helping our program for many, many, many years navigate through not only the didactic portion of the pediatrics, but also the clinical year when she can be involved. And I wanted to take this time to say thank you so much, personally and on behalf of the program, for everything that you have done, for everything you will do, which I'm sure. And we want to say thank you for your continued help in the PA program. We appreciate you so much. We appreciate you so much. Everyone here can say the same thing about you. And we'd like to present something to you. So this says, with our sincerest appreciation for, yes, you did, for your unwavering support and guidance to the faculty and students of the Physician Assistant Program at Downstate. And it's dated today, August 24th, 2024.
That is really special
and here is something for you as well. We really appreciate you, Ms. Poe.
I do appreciate this. Thank you.
And we thank you so much.
Thank you so much. Go ahead, help me. Hello, folks. Okay. Well, 27 years later, when I first walked into Downstate, I worked for a woman by the name of Dr. Gloria Valencia, who is the director of the NICU. And I remember my first interaction with the PA group. She had a list, and she said, "Come with me." And she walked to each professor, each junior faculty at Macdonald Durham, and said, "Can you give this lecture?" And she was tiny, petite, elegant, and a dragon. She was no joke. So people stepped up to the plate right away. Slowly but surely, this was released to me and was given to me to gather up the forces to support the PA program and to make sure that they did it in a timely fashion. Again, it was that blank piece of paper. I thought, this is not how you do things. Their lives need to be organized. I respect their clinical hours and their time and their contributions, and so do yours. So I developed a schedule with the pagers, yes, your pages, so we can find everybody, and your department number, and who you are. And every year when the chief residents came on board, I told them this was part of their inheritance. So they took on the gauntlet, and it has continued thus forth. I don't know the statistics for the PAs throughout the city of the country, but I will tell you this. Downstate may have had some hard knocks, but 1 in 5 physicians in this state come from downstate, and 1 in 10 in this nation comes from downstate. So I'm sure your numbers are equally great. Don't let anybody tell you that you are chopped liver. You are a finer cut. You are filet mignon. Thank you.
Hi, everyone. My name is Tasfia Tabassum, and I'm the class historian. I had the pleasure of capturing the memories, milestones, and moments that we've shared together. And this slideshow is both a tribute to and a glimpse into the friendships that we formed, the skills we've gained, and the incredible journey that we've all been a part of together. Thank you.
to Sfia for putting together such a beautiful slideshow. And yes. We just want to take a moment to thank our faculty for being with us for the past 2 years. Thank you to you guys. We have learned so much. We have had your dedicated support, and we just want to show a token of our appreciation.
I would like to give this plaque and award to Professor Edward Perchik.
I would like to give this plaque to Professor Norman McCullough.
I'd like to present this award to Dr. Abdullah Sadi.
I would like to present this award to Professor Candida St. Hilaire.
Of course, you'd be the one giving it.
I would like to present this award to our program director, Professor Andrea Trevino.
Thank you all for being here. My name is David Koyanov. I was a student representative to student government, and I would like to introduce and welcome Professor Norman McCullough to the podium to recite the professional oath with our class of 2024.
Thank you, David. Thank you. Good morning. Is it afternoon? Well, afternoon. And congratulations, you have made it. But this is just the beginning. May the class please stand. Now, last year I made a mortal error. They didn't raise their hands. You're going to pay for that. You're going to raise both hands. Compensation. All right, so I'm going to speak the line, and you're going to read it after me. And we're going to speak the last line together. So I will speak, you follow. Raise your right hand. And this is where you're going to take that oath to care for people, develop good bedside mannerism, to provide care regardless of the person, and to care for the sick. May we begin. I pledge to perform the following duties with honesty and dedication.
I pledge to perform the following duties with honesty and dedication.
I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings.
I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings.
I will uphold the tenets of patient's autonomy, beneficence, non-maleficence, and justice.
I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice.
I will recognize and promote the value of diversity.
I will recognize and promote the value of diversity.
I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine.
I will hold in confidence the information shared in the course of practicing medicine.
I will assess my personal capabilities and the limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine.
I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine.
I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community.
I will use my knowledge and experience to contribute to an improved community.
I will respect my professional relationship with the physician.
I will respect my professional relationship with the physician.
I will share and expand knowledge within the profession.
I will share and expand knowledge within the profession.
Altogether, these duties are pledged with sincerity and upon my honor. You may be seated.
To bring our program to a close, it's my honor to invite Professor Chomihan to the podium for the closing remarks. Please join me in welcoming Professor Chomihan.
Hello again. So I actually now have the honor of introducing our medical director. He was not here when we introduced faculty and staff, but now I will be remiss not to acknowledge the ever stylish, ever knowledgeable, accomplished, published. There's nothing, I mean, I can say everything about him. Professor Sammy McFarlane, can you come and address our students, please?
Thank you, Professor. It's very hard to come to the podium after Professor McCullough. It's very hard, it's a challenge, and she always does that. I would like to congratulate you guys. This is very inspiring for everyone. And now you're gonna be in the real life. There is no mannequins. The mannequins don't have feelings. They don't have fear. They don't think about the dog that they left without food in the house. They don't think. One time I was caring of a patient who was having an acute heart attack. And the guy wanted to sign out. In Kings County in the ER. Why want to sign out? Man, you're gonna die. Like, what is it? He said, because my car is parking in the fire hydrant. I took the keys and I took care of this issue. So humans are different from mannequins. So they are. So you have to pay attention. You keep an eye contact and you listen. Listening is the key. There is research that's done on physicians. They see that they interrupted the patient after 2.4 seconds or something. Like the guy couldn't even answer the question. You understand? And that's a problem we all have, the attention span. But when dealing with humans, you have to address the fears, uncertainty, and to establish trust. And that will come with the human touch. That's what makes our profession as physician assistant and physicians and healthcare providers in general different from the other professions that deal with, what is that? Is that a sad violin? So we are very proud of all of you and we trust you. And we don't say that for a compliment. In 2017, I was in an island and I got very sick, like really sick. So I came here. The person who took care of me was my own physician assistant at that time, student. Her name is Carmen, right here at Downstate. And she was the one who took care of me. And then I got like 4 operations or something. And the people who did the operations were my medical students, actually. They are now like very advanced surgeons. And when I was getting the surgery and anesthesia, I was lying down. I thought I died, and the students are appearing and to take revenge. So we do trust you, and we send you to the community. And we trust you to take care of ourselves and of our families. And that's a very big deal. And like Professor Henry was saying, that when you are from downstate, you stand out in any place. Anybody comes from downstate, you stand out because you get in very solid training, very solid training. You wouldn't know that unless if you compare or you have someone who gives you information for another program. This is very solid training. So I'm very proud of all of you, and I'm very proud to be part of this program since 2008. And congratulations, and go and do the good work that you are commanded to do. Thank you.
We have come to the conclusion about, We have come to the conclusion of our white coat ceremony for the class of 2024. I wish you great success in the future, and I especially wish you determination and perseverance to become everything you are capable of being. I'm sure I stand with your family, friends, and with the faculty and staff by saying, go forth, do your best, be professional. You'll be taking care of my family and my daughter. So we want to make sure that we gave you the best education and training to do so. So once again, congratulations. You deserve it. We honor you today, and good luck in every endeavor you have in the future.
Congratulations once again, class of 2024, family and friends. We thank you once again for joining us. At this moment, we are going to have the class of 24 stand, face your families. Everyone give them a round of applause. But family, we're going to ask you. Family, I'm just going to ask you to remain seated. The class of 24, we would like you to go to the front so we can take pictures. Thank you once again, family and friends.